All right, guys, welcome to another video by Dr. Ash. I'm coming at you today for some test taking strategies. Now, this is not all inclusive. This is just the tip of the iceberg, my friends. But let me tell you, this will make all the difference in the world because here's the reality. The reality is you cannot know everything in nursing. Shock, I know, but it is impossible to know every single little thing. So here is a couple of different tips and tricks that I have used over the years with my students. I used them when I was coming through school. These are tried and true methods. Again, not all inclusive, but definitely some of the highlights here on what you can do for test taking. And this doesn't have to be NCLEX. This can be nursing test, NCLEX test, HESI test. It really doesn't matter. So we have two main approaches when we talk about testing strategies. Oops. We can look at the content and we can look at strategies. So content, this is everything you learned. These are diseases, conditions, illnesses, disorders, syndromes, whatever name you want to call it, any type of procedures that your patient may have, and some basic definitions. Okay, that's one way you can approach a test question. It's great if you know all the information, but what we're going to focus on is strategies. And these methods can apply to any question. And a couple of examples here would be strategic words, prioritizing, and elimination of answer choices. So one of two ways. It's nice if you know all the content and you can work right through it and you're good, bing, bang, boom. But some people struggle with learning everything. So that's where your strategies come into play. So let's talk about the question. The first thing we have to do is determine what the question is asking us. What is the subject? Okay, you guys have probably all seen, if you've even taken half of a nursing test, you've seen that the bulk of the question can be all this extra fluff and stuff that you don't really need. Like the patient came into an outpatient clinic, or the client is receiving home care teaching. All those little fluffy words don't really matter, but what is the heart of the subject? Are we talking about congestive heart failure? Oh, that says here failure. Let me fix that because I know me and I will leave it there and it will drive the ever living crazy out of me. So there we go. All right, so an example would be congestive heart failure or signs and symptoms of an impending disease, disorder, or illness. Could be teaching, could be a number of different things, but you always need to focus and drill down on what is this question asking me. The next part of the question is the event. That's information, whether it be patient information, the clinical situation, what has happened is also included. That's something very specific about the event. And then, of course, we have our answer choices. So strategic words. One of the things that you can do is you can look for specific words within your question, within the root of everything that the question is asking you, to help focus your attention. It'll also help you eliminate answer choices. And there's usually one of two ways that strategic words are going to play here. It's either going to help you prioritize or it's going to help you assess. So let me give you a little bonus tip here, and that is nurses are responsible for prioritizing care, teaching a patient, assessing a patient, and certain medication administrations. So strategic words will either lead you to prioritizing or assessing your patient. So for prioritization, you may see things like most appropriate, primary, next, best, immediate. The tricky thing about prioritization is that all four answer choices could be correct. Okay, this is where people get tripped up. But you need to think about what is the one thing, what is the most appropriate of these four, or if within your question root, it tells you that you've already done X, Y, and Z for this patient. What is the next thing that you want to do for your patient? And a little bit later on, I'm going to tell you exactly how to determine what is best, next, immediate, etc. Some examples of assess, you may see the words determine, gather, collect, or it may even say assess. Okay, any of those synonyms for assess. Now, we also have something called the event query, and that means there's either a positive or a negative event query. So an example of this would be a positive that is looking for a correct option. So the correct answer choice is the correct answer to this question. You may see something like which of the following statements indicates an understanding by the patient? Okay, that tells me whatever the patient says back to me is the correct answer to the correct question. A negative event query is the actual opposite. Okay, so here's the funny thing. So the negative, and we've all seen these as well, it's asking you which of these options are incorrect. So 3 of them will be yes questions, and there will be one that is this doesn't fit. And that looks like which of the following statements indicates a need for further teaching. Which of the following statements by this client indicates a need for further teaching by the nurse? Something of that nature. Let's move on to the answer choices themselves. Again, there are more testing techniques about the question, but again, I want to make this quick and simple for you guys. So for answer choices, again, we have to refer back to what the question's asking us. Is this a negative or a positive query? So am I looking for a right answer or a wrong answer? Oh, the dreaded dun dun dun, SATA or select all that apply. And then we have a couple of different strategies like alike options, umbrella prioritization, which I told you we'd come back to, and delegation. Again, these are the highlights because there are many, many more, but I want to give you guys the quick and dirty. So alike options, if you are looking for just one correct option, so this does not apply to select all that applies. These are only when you're looking for one correct option, like either A or B or C or D. You want to look for anything that might be alike, and we eliminate all like questions. So I have an example for you here. 3 of these are essentially the same thing. They're not the same thing in that it's the same disorder or it's the same medicine or anything like that, but it's the same because 3 of these indicate that the patient is losing fluid, where one of them actually hints that this patient would be retaining fluid. So if you look at diuretics, ileostomy, and a patient on NG tube or nasogastric tube suctioning, those patients are all losing fluid because the ileostomy constantly drains. Patient on diuretics, there is an increase in their urinary output. And then, of course, when we're suctioning gastric contents, that is a loss of fluid as well. So the only answer option here, without even knowing what the question is, guys, this is where my mind gets blown. You don't even need to know the question. You automatically know that C, patient with end-stage renal disease, ESRD, is your correct option because that's the only one that doesn't match the others. The other thing we want to do is we want to look for umbrella options. That is a choice that includes all other choices. So it's either broad or very universal. Typically, the umbrella option is correct. For instance, if you have a patient that is supposed to be on contact precautions and you have 4 choices that are asking you what kind of protective equipment should the nurse use in that room, look for a choice that includes the other choices. Okay, when you have a very broad or universal choice, chances are that's going to be your correct answer. All right, let's move on to prioritization. I told you before we have those strategic words that are placed inside of the question. That's a next or immediate or most appropriate, okay? So here's the thing. Again, all of those options could be correct, but you are responsible for the correct order of things. So whenever you see a strategic word, these are the top 4 things that should come to your brain. You should think airway, breathing, and circulation, or the ABCs. Number 2, you should think Maslow's hierarchy of needs. When we look at that pyramid, everything on the first level of that pyramid should be addressed. Food, water, shelter, sex, oxygen, those are all on that first level. Then we'd move up to the next level as needed. The third thing is the nursing process. We come back to assess, and the D is technically diagnosis, but that's determining the problem, right? We're back to the ADPI. Then we plan, then we implement, then we evaluate. So if your choices look like any of those, follow the nursing process. And then, of course, we want to look for any abnormalities. That's typically last on the list because your NCLEX and nursing test, we love those first 3 first. We love ABCs, we love Maslow's, and we love the nursing process, particularly when we're asked to assess. The other thing with the nursing process is sometimes those answer choices, you will see implementation and evaluation as an answer choice. So be very careful when you're reading the question to see if, as the nurse, have you already assessed. If you have not, then your choice should be assessed. And lastly, I want to talk about is delegation. Just had to make sure that was last. So delegation is matching the client's needs with the worker's scope of practice. You have to remember that these are national standards, okay? Very national, broad standards. The NCLEX stands for the National Council, okay? So that's where the NC comes from. So you will never be asked something specific to your state. Same thing with nursing tests. I probably shouldn't have told you that, but your nursing test banks are national. They're not particular to your state. So we have some very broad concepts when we're looking at delegation questions. Number one, and I've said this already, but this is just kind of another hint, the RN, so the registered nurse, is responsible for assessment, planning, analyzing, implementing, evaluating, again, the nursing process all over again, supervising care of a patient, initiating the teaching of a patient, and administering IV medications, okay? When we're looking at delegation type questions, you do not want to delegate anything that an RN should be doing, okay? You want to delegate, again, very broadly, skincare, range of motion, ambulation, grooming, personal hygiene, turning, bathing, brushing of the teeth, shaving, foot care, dressing. All of those things can be delegated to a unlicensed personnel. Okay, for example, I know here in the state of North Carolina, our CNA 1s and our CNA 2s have a varied level of things that they can do. A CNA 2 can do a lot of different things, but that's not the same in Kentucky or California or Washington State or Nevada, or pick whatever state you want to pick. Okay, so when you see a delegation question, please use this guideline, because this is the national standards and this is the general rule of thumb. So if you're asked to delegate something and it's related to hygiene, grooming, ambulation, range of motion, skincare, toileting, any of those, that can be handed off to an unlicensed personnel, or a UAP, I think is what the NCLEX now calls it. All basically the same thing. So anyways, that is the short and dirty of testing strategies. Again, there are many, many more things that we could go over, but these are the highlights. So please let me know in the comments if you found this helpful, and I will talk to you guys another time. See you later.